Richard Harlow didn't knock. That was the thing people who worked under him learned to accept. The CEO of Redstone Military Medical Center didn't knock on doors, didn't wait, didn't ask permission. He owned the building. He owned the budget. In his mind, he owned every single person inside these walls. So when he pushed open the door to the staff changing room on the third floor and found a blonde nurse standing there in a state of undress, he didn't apologize. He didn't back away. He crossed his arms, looked her up and down the way a man looks at something he thinks belongs to him, and said with a cold, deliberate smirk, "Don't flatter yourself. Nobody in this building is worth that much of my time." And then he just stood there. If you're watching right now and that made your blood boil, good. Because what Richard Harlow didn't know in that moment was that the woman he just humiliated had once neutralized an armed insurgent in complete darkness with nothing but her bare hands and a piece of wire. Subscribe to this channel right now and drop your city in the comments below. I want to see how far this story travels. Now let's go back to where everything began. The morning shift at Redstone Military Medical Center started the same way it always did, loud, chaotic, and completely indifferent to whatever personal drama any individual nurse or doctor happened to be carrying through the doors. Mia Walker carried hers quietly. She always did. She clocked in at 6:47, 13 minutes before her official start time, because she'd learned long ago that 13 minutes was exactly how long it took to do a proper visual sweep of the floor, check the overnight handover notes without having to ask anyone twice, and mentally prepare for whatever the next 12 hours were going to throw at her. Old habits, the kind that didn't wash off no matter how many years you spent pretending to be someone calmer, someone softer, someone who hadn't once spent 4 consecutive days in a mountain range that didn't appear on any civilian map. She pulled her blonde hair up into its usual tight bun without looking in a mirror. She didn't need one. The motion was automatic, the same way breathing was automatic, the same way her eyes cataloged every face, every posture, every subtle tension in a body as she walked past the nurse's station. She noticed things. She always noticed things. Walker. Brenda Cho, the charge nurse, didn't look up from the chart she was annotating. "We've got a full house. Trauma Bay 2 had a rough night." "I saw the board," Mia said. "Dr. Harrison wants everyone briefed by 7:15. "I'll be there." Brenda finally glanced up, studying Mia the way she sometimes did, with that particular expression that sat somewhere between mild curiosity and mild suspicion. Mia had worked at Redstone for 2 years and 4 months. She was efficient, reliable, and almost completely unknowable. She never talked about her past. She deflected personal questions with a calm that some of the younger nurses found unnerving, and most of the senior staff simply attributed to introversion. "You eat breakfast?" Brenda asked. "I'm fine." "That's not what I asked." "Coffee counts." Brenda pointed a pen at her. "It does not count. Eat something before the briefing." "You look like you haven't slept." Mia hadn't slept, but not because of anything Brenda needed to know about. She'd spent most of the previous night reading through a series of mission debrief files that an old contact had forwarded to her files she wasn't technically supposed to have access to, concerning a SEAL team extraction gone catastrophically wrong somewhere in a region the government would never publicly name. 3 men unaccounted for. 1 confirmed dead. 1 still in the field. 1 being transported. She'd closed her laptop at 4 in the morning, stared at the ceiling for 90 minutes, and decided that whatever was coming, she would deal with it the same way she dealt with everything, calmly, efficiently, and without letting anyone see the machinery turning underneath. The briefing room smelled like burnt coffee and institutional anxiety. Dr. Mitchell Harrison stood at the head of the table with the particular posture of a man who considered himself the most important person in any room he entered, shoulders squared, chin slightly elevated, 1 hand resting on the table in a way that was meant to look casual, but read as deliberate. Harrison was a capable trauma surgeon. Mia would give him that. He had steady hands and a solid understanding of protocol, and in straightforward cases, he was exactly the kind of doctor you'd want managing your care. He was also, as Mia had assessed within her first week at Redstone, someone who had never once in his professional life considered the possibility that the person standing behind him knew more than he did. "We have a transfer incoming," Harrison said, clicking through something on the tablet in front of him. "Military classified inbound via medevac. ETA approximately 40 minutes. Multiple gunshot wounds, internal hemorrhaging, reported blood pressure, critical. He's been field stabilized, but the field medics flagged significant concern about internal damage that wasn't fully addressed before transport. We'll prep Trauma Bay 1. What's the injury profile? Asked Dr. Yemi Adaora, one of the second-year residents. I just told you. Gunshot wounds, internal hemorrhaging. I meant the pattern, entry and exit organ proximity. We'll assess on arrival. Harrison set the tablet down. I want full blood panel ready, 2 large bore IVs type and cross for O negative. An image go on standby. Standard protocol. Mia was quiet through all of this. She was watching the notes on the tablet from 3 seats away, reading them upside down with the same ease she read everything, including the detail that Harrison had apparently skimmed over or hadn't recognized the significance of. The field medic's notation in the transfer summary: suspected tension pneumothorax partially treated. Bilateral breath sounds compromised. Needle decompression performed field side efficacy uncertain. Standard protocol was going to be a problem. She said nothing, not yet. She spent the next 35 minutes prepping her section of the trauma bay with the careful, unhurried precision that had become her professional signature. Teresa Lynn, one of the newer nurses, worked beside her and occasionally glanced over with a small, puzzled expression, the way people looked when they couldn't quite identify why someone else's competence made them feel slightly inadequate. You ever worked a military transfer before? Teresa asked. A few times. Are they different? Like, are the injuries? The injuries are different? Mia said. The medicine is the same, mostly. Mosuang. Field medicine and clinical medicine don't always speak the same language. Sometimes there are gaps. She placed an IV kit on the tray with quiet precision. The gaps are where things go wrong. The medevac landed at 7:53. Mia heard the rotors through the reinforced windows before anyone announced it over the intercom. She was already at the bay doors when the gurney came through, and then she stopped. Not visibly. Nothing in her posture changed, nothing in her face, but something deep in her chest performed a complicated involuntary lurch, the kind that happens when your body recognizes something before your mind has finished processing it. Captain Alex Donovan. She hadn't seen him in 4 years. He looked like 4 years in active combat, which was to say, he looked significantly older than the last time she'd stood in the same room as him. Thinner, harder with new scar tissue layering over old. But it was unmistakably him. The jawline, the particular set of his shoulders even unconscious. The tattoo on the inside of his left forearm that she'd watched him get in a town in South America whose name neither of them was allowed to say out loud. He was barely alive. The transport medic was rattling off vitals as they pushed through the doors: blood pressure 62/40, heart rate 120, and irregular O2 sats at 84% on supplemental oxygen, GCS of 7. What happened to the decompression? Mia said, stepping up alongside the gurney. The transport medic looked at her with the automatic uncertainty of someone encountering a nurse who didn't wait to be spoken to. Field needle decompression right side approximately 90 minutes ago. We lost significant ground on O2 during transport. Did it hold initially? We're concerned about retention. Mia's hands were already moving, checking, assessing fingertips, reading what monitors were only beginning to catch up to. She felt the tracheal deviation. Subtle, but there. The neck veins were distended. She pressed 2 fingers to the right side of his chest and listened to her own instinct confirm what the numbers hadn't fully articulated yet. The tension pneumothorax was back. Building. The needle decompression had bought him time, but the time was up. We need to decompress again, right side now. Walker. Harrison's voice came from behind her, crisp with the particular edge he used when someone had stepped out of what he considered their lane. Step back and let us get him set up. We'll do imaging first. She turned and looked at Harrison with an expression that contained everything she wasn't going to say in the next 30 seconds. His trachea is deviated. Breath sounds on the right are absent. He's got JVD and his pressure is crashing. Imaging is going to take time we don't have. Harrison looked at her the way he always looked at her, with the professionally contained dismissal of a man who had categorized her long ago and saw no reason to revise. We follow protocol, Nurse Walker. That means imaging to confirm before any invasive procedure. If we wait for imaging, step back. The word landed like a door closing. She stepped back. Not because she agreed, not because she was afraid. She stepped back because she understood institutional dynamics the same way she understood combat dynamics. You pick your moment and you don't break cover before the situation absolutely demands it. But she kept watching. Every second watching. The imaging took 11 minutes. 11 minutes during which Alex Donovan's blood pressure dropped to 58/35, his heart rate climbed to 134, and his oxygen saturation fell to 79%. She watched the numbers with the cold, precise attention of someone calculating a very specific window. When Harrison looked at the imaging results and finally said, "All right, tension pneumothorax confirmed, prep for decompression." His voice was measured and controlled, the voice of a man making a timely clinical decision. Mia was already prepping. She had been prepping for 4 minutes. What happened next unfolded in the particular accelerated slow motion that Mia had always experienced under pressure, not faster exactly, but sharper. Every detail present, nothing blurred, nothing missed. Harrison positioned himself and began the procedure, but his hands hesitated for 2 seconds on the landmark placement. 2 seconds. Almost nothing. Almost invisible. Except Mia saw it. She saw it, and she saw the corresponding drop on the monitor, and she made a decision. "You're 2 centimeters medial," she said. Harrison's jaw tightened without breaking his focus. "I know what I'm doing." "I know you do. And you're still 2 centimeters medial. The scarring from the previous decompression is pulling the landmark. You need to adjust for it." Silence, Mom. 5 people in that bay, and not one of them breathed. Harrison's hands moved. A small adjustment, the kind that required no admission, the kind that could be attributed to routine recalibration. But Maya watched his eyes in the half-second before he moved, and she saw the thing that happened in a person's expression when they recognized against every preference that someone else was right. The procedure worked. The O2 sats began climbing 79, 83, 87, 91. The blood pressure began stabilizing. In the controlled chaos of readjusting medication and monitoring, nobody was looking at Mia. Nobody saw her exhale. She stayed close, working the IV lines, adjusting the drip rates with adjustments so quiet and precise that they registered as second nature, which they were only not the second nature anyone in that room understood. She was doing the math in her head, the combat medics math, the calculation of fluid resuscitation for a specific body weight under specific trauma conditions, the kind of math that accounted for variables she'd learned not in any medical school, but in places that didn't appear on any syllabus. Teresa Lynn watched her from across the gurney with wide eyes and said nothing. At some point during the stabilization, Dr. Adeora appeared at Mia's elbow and said quietly, "How did you know about the landmark?" Mia kept her eyes on the monitors. "Experience." "What kind of experience?" "I've never seen a nurse." Adeora blinked. "What?" "I'm a nurse," Mia said. "That's what kind." And that was the moment that Richard Harlow walked in. She heard him before she saw him. The particular rhythm of Italian leather shoes on linoleum, a sound she'd cataloged weeks ago, when Harlow had done his first administrative walkthrough of the trauma floor and spent 45 minutes inspecting equipment and approximately 0 minutes speaking to the staff who used it. He had the physical presence of someone who had spent decades believing his arrival changed the temperature of rooms, and the infuriating thing was that physiologically he wasn't entirely wrong. People's postures shifted, voices lowered by half a register. Harrison straightened. Harlow walked to the edge of the bay, surveyed the situation with the expression of a man reviewing a quarterly report, and said to Harrison, "How is he stabilized?" "We got to him in time." "Good, good." Harlow nodded, the slow, deliberate nod of someone absorbing information they've already decided to feel satisfied by. "This one's going to attract attention. I want a full report on my desk by end of day. Confidential. Military protocol, nothing goes external without my sign-off." "Understood." Harlow's gaze swept the room inventory, not acknowledgement, and landed briefly on Mia. Not because he recognized her as significant, but because he noticed her the way certain kinds of men noticed women in rooms of reflex, as reflexive and as meaningful as breathing. "And make sure your people know to keep their mouths shut," he said, still to Harrison, but his eyes still on Mia. "Especially the support staff." He left the same way he arrived. Without looking back, Teresa Lynn exhaled through her nose. Dr. Adaora found something suddenly very important to study on her tablet. Harrison returned his attention to the monitors with the careful blankness of a man performing neutrality. Mia said nothing. She checked Alex Donovan's pulse manually, a habit, not a necessity, and felt his heart beating with the stubborn, irregular insistence of someone who was not finished yet. She had known that about him once, that he had a particular relationship with not being finished, that whatever should have killed him hadn't, and whatever should have broken him hadn't either. And there was something in that she had always found not comforting exactly, but something. She pulled the supply cart to the side and began inventorying what had been used, restoring order to the tray with the automatic efficiency of long practice. "Walker," Harrison's voice. She turned. He looked at her with an expression she couldn't quite categorize. It wasn't gratitude, wasn't apology, wasn't the specific flavor of condescension he'd been running on all morning. It was something more honest than any of those, something he clearly hadn't planned. "Good catch," he said, finally, flatly, like the words had been negotiated with some internal authority and released only after extensive review. She looked at him for a moment. "Yes," she said, "it was." And she went back to work. The morning continued. She checked on 3 other patients in her assigned section, administered 2 medication rounds, caught a charting error that would have resulted in a double dose of anticoagulants for a post-op patient in room 7, and ate half a granola bar over a sink in the break room at 10:15. Alex Donovan was transferred to the ICU at 11:40. She wasn't assigned to the ICU that day. She told herself that was fine. She told herself it didn't matter. She told herself it 16 times over the course of the afternoon, each time her mind drifted toward the 3rd floor, toward the particular room she'd looked up on the floor plan, during a bathroom break she'd taken for no stated reason, toward a man she'd once trusted with her life in places that didn't exist. At 2:30, she slipped upstairs during a gap between tasks. She stood outside the ICU room for 30 seconds. Through the narrow window, she could see the monitors, the steady lines, the controlled beeping of a system reporting stability. She could see his hand resting on the blanket, motionless. She put her palm briefly against the glass, not a gesture she'd planned, not something she would have done if she'd been thinking, and she was always thinking, and then she walked back to her floor without looking back. At 3:47, her section had 3 new admissions, and she stopped thinking about anything except the work. At 4:50, as she was charting at the end of her shift, Brenda appeared beside her and said, "Harlow's doing floor inspections tomorrow. Full staff, wants everyone in dress code, wants everything documented properly, wants to see the trauma-based staffing breakdown." Mia kept typing. "Fine." He mentioned it. Brenda said carefully that he wants to talk to some of the staff individually. Apparently he's restructuring some of the nursing positions. "Fine," Brenda hesitated. "He's not good news, Mia. I've seen the type. He doesn't see people, just resources," Mia finished. "Yeah, I know the type too," Mia said. She hit save on the chart and picked up her jacket. "I'll be fine." What happened next, the thing that would pull apart the carefully constructed ordinary life of Mia Walker and lay everything underneath it bare for an entire institution to see, began the following morning. Not in the trauma bay, not in a crisis, not in the blinding, urgent clarity of a life on the line. It began in a changing room in 30 seconds of silence, in the way a door opened without a knock, and in the particular irreversible mistake of a man who looked at a woman and saw nothing worth fearing. The changing room on the 3rd floor was supposed to be empty at 6:30 in the morning. That was the thing Maya had confirmed before she used it, a habit she couldn't shake, the kind of pre-action verification that had once been the difference between walking out of a building and not walking out at all. She'd checked the schedule. The 3rd floor staff didn't rotate in until 7. The room would be unoccupied for at least 20 minutes, enough time to change into her scrubs, review the overnight notes she'd pulled on her phone, and get back to baseline before the floor came alive. She had her back to the door when it opened. No knock, no warning, just the handle turning and the door swinging wide, and Richard Harlow walking in as though the concept of permission had never once occurred to him as relevant. She didn't freeze. That was important. She didn't freeze, didn't make a sound, didn't do the thing that a startled person does when they're caught off guard. What she did was go absolutely, completely still, in the particular way that operators went still when they were in the middle of processing a threat and deciding on a response. It lasted less than 2 seconds. It felt much longer. Harlow stopped walking. He took in the situation with an expression that moved through several things in rapid succession: surprise, assessment, and then something that landed in territory that made Mia's internal temperature drop about 10 degrees. He didn't leave. He crossed his arms. "Don't flatter yourself," he said with the deliberate, unhurried delivery of a man who had never once in his life suffered a consequence for the words that came out of his mouth. "Nobody in this building is worth that much of my time." The silence that followed lasted exactly 4 seconds. Mia counted them. Then she turned around. She was fully dressed. She'd gotten the scrub top on before he'd entered, which was the only reason she was able to look at him with the level of composure she managed, because composure was a resource, and she was spending every available unit of it on keeping her face neutral and her hands still at her sides. She looked at Richard Harlow with the same expression she'd used when dealing with hostile military contractors in places where losing her temper had consequences measured in casualties rather than HR reports. She said nothing. That seemed to unsettle him slightly. Most people, when Harlow said something cutting, either flinched or scrambled to respond. The silence of a woman who was simply looking at him without any discernible effect, it appeared to fall outside his expected range of outcomes. He filled the silence the way men like him always filled silence, with more of himself. "You're on the trauma floor, aren't you, Walker, is it?" He said her name the way people said the names of items on an inventory list. "I've been reviewing staffing structure. I was looking for a quiet space to make some calls." He gestured around the room as though explaining himself was a courtesy he was extending, not an obligation. "You might want to check the scheduling board before you use rooms that aren't officially designated for your floor." She held his gaze for another 3 seconds. "This room," she said with a quiet that was not the quiet of submission, "is listed as shared staff space. It doesn't belong to a floor or to an administrative office." Something shifted in Harlow's face. Not much. A degree or two of the temperature behind his eyes. "Careful," he said, just the one word, like a hand placed on a surface to establish ownership of it. "I'll finish getting ready," Mia said, "and I'll be on the floor in 5 minutes. She turned back to the mirror. She heard him stand there for another moment, the particular weight of a man who was unaccustomed to being dismissed, deciding whether to escalate, and then she heard his shoes on the floor as he left, and the door closed behind him, and she exhaled one slow breath through her nose. Her hands, she noted, were perfectly steady. The rest of the morning operated on the surface level of routine while running something much colder underneath. She administered medications, updated charts, coordinated with the overnight team on 2 patients who'd had complications. She did all of it the way she always did, everything precisely quietly, without drawing attention to the fact that her mind was running a parallel track that had nothing to do with any of it. She was thinking about the file she'd received 3 nights ago. The extraction mission. The region with no civilian name. She was thinking about the detail she hadn't allowed herself to focus on when she'd read the debrief. The detail that now felt like a stone she'd been carrying in her chest since the moment she'd seen Alex Donovan come through those bay doors. 3 men unaccounted for. She'd told herself that meant 3 men missing. It could mean other things. Brenda caught her at the supply station just before 9. "Harlow's doing his rounds early. He moved everything up. He's on 2 right now." "All right. I'm serious, Mia. He's been..." Brenda lowered her voice. "He talked to Marcus from housekeeping this morning for about 4 minutes, and Marcus came out looking like he'd been taken apart. He's got a way of just reducing people." "I know. You've talked to him." Mia placed a supply order on the tray with careful precision. "Briefly. And he's exactly what he looks like." She picked up the tray. "I've dealt with worse." Brenda looked at her. "When have you dealt with someone like Harlow?" "Different context," Mia said. "Same architecture." She was in room 7 checking on her post-op patient, Mr. Garza's 72 hip replacement, blood pressure running slightly high, stubborn as anything about his fluid intake, when she heard the particular quality of the corridor falling quiet. Not the organic quiet of a slow moment, but the performed quiet of a floor adjusting to the presence of authority. Harlow's voice reached her through the open door before she saw him. He was talking to Harrison in the hallway, or more precisely, he was speaking at Harrison in the specific tonal register of someone who had already concluded what they wanted to say and was delivering it as information rather than conversation. The staffing breakdown you submitted is inadequate, Harlow was saying. I need trauma bay coverage restructured. I want senior-level certifications on every shift, and I want a review of every nurse on this floor's classification. The team is strong, Harrison said. His voice was careful, the voice of a man who disagreed but was doing the math on how much that disagreement was going to cost him. Strong is a subjective assessment. I deal in certifications, in billable classifications, in liability profiles. You have nurses on this floor doing work above their documented pay grade, and it creates exposure. A pause. I also want a personnel review of anyone whose background isn't fully documented in the HR system. There's a walker on the trauma floor, her records are thin. Mia went still. Mr. Garza looked up from his bed. You okay, hun? Fine. She adjusted his IV line without looking at her hands. Drink your water, Mr. Garza. I don't like water. I know, drink it anyway. In the hallway, Harrison said, Walker is one of the most effective nurses on the floor. Effective is another subjective assessment. I need documentation. Harlow's voice moved. He was walking, getting closer to the door. Set up the personnel review for this afternoon. 3:00. His footsteps passed the door. Mia watched Mr. Garza drink 3 sips of water and pretend it was under protest, and she stood there thinking about documentation and thin records in a background that was indeed by design exactly as thin as Harlow had identified. When she'd left the Navy, the transition team had helped her build a civilian identity that was truthful in every verifiable particular and strategically incomplete in the ones that weren't. It wasn't falsification. It was the deliberate omission of information that was classified, that she had signed papers agreeing would remain classified, and that served no function in a civilian nursing career except to make people ask questions she wasn't cleared to answer. The HR system at Redstone had her nursing degree, her state licensure, her certifications, and 4 years of civilian nursing experience. It did not have the 7 years before that because those 7 years were not available for documentation. It was a clean record. It was supposed to be invisible. Harlow had noticed it in less than 48 hours. She finished her rounds with the kind of concentrated focus that left no room for anything else, and made her way to the break room at 11:15 for what was supposed to be a 15-minute lunch. Teresa Lynn was already in there, sitting with her hands wrapped around a coffee cup, staring at the table with an expression of contained agitation. He talked to you, Mia said. Teresa looked up. Is it that obvious? A little. He asked me 3 questions, and somehow, by the end of it, I felt like I'd done something wrong. Teresa shook her head. He asked me how long I'd been on this floor, what my supervisor arrangement was, and then he said he actually said that he hoped I understood the difference between clinical responsibilities and administrative ones. What does that even mean? It means he wanted you to know he's watching, Mia said. It's a dominant signal. He's establishing territory. Teresa blinked at her. A dominant signal. Some people lead by making people feel valued. Some people lead by making people feel monitored. She sat down and unwrapped her granola bar. He's the second type, it dawned. Have you met him? He came up to me, and I've heard he's already... Teresa stopped. He didn't do anything officially terrible. He was technically polite, but I felt diminished somehow, like he ran an assessment and found me not worth full attention. Mia said nothing for a moment. Then, did you know that in certain field environments, psychological destabilization of local personnel is a documented tactical method? Teresa stared at her. What? Making people feel small before they have had a chance to establish footing. It's a control mechanism. It's effective because it doesn't leave marks. Where did you learn that? Mia looked at her granola bar. Nursing school, she said, which was not technically a lie because she had learned it and she had attended a nursing school, and the logical connection between those 2 facts was something she was choosing not to clarify. The afternoon moved like a current, fast and directional, and she let herself be carried by it rather than fighting it, because fighting a current when you needed to conserve energy was the kind of mistake that got people killed. She had a 3:00 personnel review to think about. She had a man in the ICU who knew her call sign and had whispered it in front of Harrison and Teresa and 2 other nurses and a resident, and she had to decide what that had done and what it was going to do next. She was on her way to check on 2 patients before the review when she heard it. The sound wasn't dramatic. It was the specific quality of silence that follows a monitor alarm that has just stopped, not because the situation resolved, but because the power strip was kicked by a gurney being moved too fast and the monitor lost connection for 4 seconds before resetting. It happened sometimes. It was the kind of thing that created a brief sharp tension and then resolved into the ordinary chaos of a medical floor. Except what Mia heard in those 4 seconds of alarm silence was the sound of Dr. Adaora's voice from ICU room 3 saying his pressure is dropping. Get Harrison now. She moved. She was in the room before the instruction had finished being relayed. Adeora was at the bedside, hands already on the patient, face controlled, but eyes wide with the particular quality of wide that meant she was operating at the edge of her experience. The patient in the bed was Alex Donovan. His blood pressure on the reconnecting monitor read 64/38. What happened? Mia said. Even deterioration. He was stable. I was doing a routine check, and he just... Adora shook her head. Her heart rate's climbing. I think there's something we missed. Mia's hands were already on him. Not the clinical hands of routine assessment, but the specific hands of someone reading a body like a language she was fluent in. She pressed, listened with a stethoscope she'd pulled from the bedside, moved through an assessment sequence that took 45 seconds and covered ground that a standard protocol would have taken 4 minutes to reach. It's not the chest, she said. His abdomen. There's a bleed they didn't catch on imaging. Mesenteric, I think. It was slow building, and the imaging has focused on the chest injury. We need Harrison. We need a surgical consult right now, and we need to call OR, and we need to start a second large bore IV before his pressure drops any further. She looked at Adeora. Can you do those things while I stabilize him? Adeora hesitated for exactly 1 second. It was the hesitation of a doctor calculating whether to defer to someone who was, by institutional designation, supposed to defer to her. Then she picked up the room phone. Mia worked. She didn't perform. Working didn't narrate it, didn't look up to see who had come into the room or what expressions were on their faces. She put in the IV, she adjusted the fluid rate, she watched the pressure numbers and made micro adjustments based on a calculation that drew from a knowledge base she had never documented on any resume. Harrison arrived at 4 minutes. He looked at the situation, looked at Mia, and said, "What's your assessment?" She told him, specifically clearly using the correct terminology and the correct reasoning, without hedging and without framing it as a suggestion. She spoke the way she'd been trained to speak in the field, declarative, confident, actionable. Harrison listened. He actually listened, which she registered as a data point, a change from yesterday's version of him. Get OR on the line, he said to Adeora. Walker, stay with him. She stayed. In the controlled intensity of the next 20 minutes as the room filled and then emptied, as Donovan was prepped for emergency surgery, something happened that she hadn't anticipated. In the brief window between the OR team arriving and the gurney moving, Alex Donovan's eyes opened. Not fully, not the clear, oriented opening of someone returning to consciousness. A partial drug and pain-filtered crack of awareness, the kind where the brain is present just enough to locate something familiar in the chaos surrounding it. His eyes found her face. His mouth moved. She leaned down without thinking about whether anyone was watching. "Raven," he said. His voice was barely there, thread-thin rough from the intubation that had been placed and removed, abraded by everything his body had been through in the past 24 hours. But the word was clear, deliberate. Her call sign. She'd had it for 7 years, and then she'd left it behind with everything else. And she hadn't heard it spoken aloud in 4 years. And she hadn't realized until the word hit her ear how much had been resting on that 4 years of silence. "I'm here," she said, quietly, "just for him. You're going to surgery. You're going to be all right." His hand moved against the blanket, not reaching, just moving the involuntary motion of someone trying to make their body do something their conscious mind couldn't fully direct. His fingers found her wrist, not grabbing, just contact. The way you touched a fixed point when everything was moving. "Don't," he started. "Donovan." She kept her voice low and even. "Don't talk. Save it. They don't know." His grip tightened for 1 second. "Mission, not over. Listen to me, Raven. The mission, not..." The OR team moved the gurney. His hand fell away from her wrist. She straightened up and stepped back, and she felt the eyes in the room land on her from three different directions simultaneously. And she knew that word had been heard. She knew it the way you know when the environment has changed around you, not from any single signal, but from the composite weight of everything shifting at once. Adaora was looking at her. Harrison was looking at her. Two OR nurses were looking at her with the particular expression of people who have registered something they don't have context for and are filing it away for later processing. The gurney moved through the door. The room cleared. The monitors went quiet. Mia stood in the center of that room alone for exactly 8 seconds. Then she walked out, went to the end of the corridor, stood at the window, and let herself have 8 more. The mission isn't over. She turned those words over in her mind with the care of someone handling something that was potentially unstable. Alex Donovan in the field was a man of precision. He didn't speak when he didn't need to, didn't use words loosely, didn't say things for comfort or effect. If he'd spent some of the last of his conscious energy telling her the mission wasn't over, he had meant it in the specific operational sense. Something was still active. Something was still in motion. And whatever it was, it had followed him here. She was still standing at that window working through the implications when she heard footsteps behind her and turned to find Richard Harlow standing in the corridor with his phone in one hand and an expression on his face that she hadn't seen from him before. Not contempt, not dismissal. Something colder and more focused than either of those. "Personnel review," he said. "My office. Now, we're not waiting until 3. She looked at him. "Of course," she said. She followed him down the corridor and into the elevator, and as the doors closed, she ran the odds in the efficient, dispassionate part of her mind that had never fully stopped running odds since the day she had learned how. Harlow had heard the word Donovan had said, or someone had told him. Or he had already known something about her, which was a different kind of problem with different implications. She didn't know which of those was true yet, but she was going to find out in the next 10 minutes. The elevator opened on the administrative floor. She stepped out, and in the moment before she followed Harlow down that corridor, something settled in her, not resolve exactly, because resolve implied effort, and this required no effort. It was simpler than that. It was the quiet, absolute clarity of a person who has been operating in someone else's version of their identity for 2 years and 4 months, and has just realized that version is about to be over. Whatever was coming, Mia Walker was going to meet it as herself. All of herself. Harlow's office smelled like expensive leather and the specific kind of silence that gets purchased along with corner view windows and mahogany furniture. Mia sat across from his desk with her hands resting loose in her lap, and her posture the kind of neutral that required no effort from her because she had held positions of stillness in environments where moving at the wrong moment had consequences measured in something far more serious than career trajectory. Harlow didn't sit immediately. He stood behind his desk, set his phone face down on the surface, and looked at her the way he'd been looking at things all morning, like an assessor cataloging an asset he wasn't sure was worth its listed value. "You've been at this hospital for 2 years," he said, 2 years and 4 months. "Your HR file lists a nursing degree from University of Maryland State licensure, 2 civilian hospital positions before Redstone." He paused. "And a 7-year gap before any of that." She met his eyes and said nothing. "People don't have 7-year gaps," he said. "Not clean ones. Not the kind where there's no employment record, no tax filing trail, no address history. People disappear off the grid for 7 years for a handful of reasons, and most of them are not reasons I want attached to a liability profile in my medical center. My background was reviewed when I was hired," Mia said. "I passed every required clearance. You passed whatever the HR department here was equipped to run, which is not the same thing." He sat down, finally leaning back with the deliberate ease of a man who wanted you to understand that his comfort in this room was structural, not negotiable. "I have resources they don't. I ran a deeper check this morning." Her pulse didn't change. She'd learned that particular control so long ago, it was no longer something she maintained consciously. It simply was like the color of her eyes. "And," she said, "and I found a wall." He let that sit for a second. Not absence of information. A wall, which means the information exists and someone decided it wasn't accessible. He tilted his head slightly. "That's a very specific finding, Nurse Walker. That tells me something. It tells you my background includes work that's classified, she said, which is not uncommon for people who've worked in certain federal capacities. It doesn't tell you anything negative. It tells me you're not what you're presented as. I'm a nurse, she said. That's what I'm presented as. That's what I am. Harlow studied her for a moment, then he opened a folder on his desk paper, which was itself a statement, the deliberate choice of a man who wanted physical evidence of his preparation visible on the surface between them. The patient brought in yesterday, Captain Donovan. You had a prior relationship with him. It wasn't a question. Mia didn't answer immediately, not because she was caught, but because she was deciding in the space of 2 seconds exactly how much truth to extend to a man who had not yet demonstrated he deserved any of it. I knew him, she said, previously. In what context? A professional one. A professional context that apparently involves call signs. He looked at her steadily. One of the nursing staff reported that Captain Donovan, regaining partial consciousness before surgery, even addressed you by a name that wasn't yours, a call sign, the kind used in military special operations units. She absorbed that information, identified who had reported it, filed the file, and moved on without letting any of the processing show on her face. People say unexpected things coming out of sedation, she said. They do, Harlow agreed pleasantly. They also sometimes say exactly what they mean. And a man with multiple gunshot wounds, barely conscious, spending some of his last waking energy on a specific word addressed to a specific person, that's not sedation confusion. That's recognition. He closed the folder. I want to know who you are, Walker. The real version. Mia looked at him for a long moment. The real version, she said quietly, is sitting in front of you. I am a nurse. I take care of patients. I'm good at it. Whatever else I may or may not have done before this job is not your access to have. Harlow's expression didn't shift dramatically, but something behind his eyes recalibrated the almost imperceptible adjustment of a man revising his tactical approach without abandoning his objective. Here's what I can do, he said, and his voice shifted into the register of someone making an offer they had already decided wasn't negotiable. I can initiate a formal personnel review that goes above the HR level, which will trigger external inquiry into your background, which will create documentation which will become visible. Or, he paused, you can be transparent with me now privately, and we handle whatever this is internally. You're asking me to choose between two things you're presenting as options, Mia said. They're not options. They're two versions of the same move. Harlow blinked, just once. The blink of a man encountering a response outside his expected range. You're trying to get information, she continued, keeping her voice level and her tone conversational, the way you stayed conversational when the conversation was actually something else entirely. The formal review isn't a threat, it's a leverage mechanism. You're not actually going to initiate external inquiry into a classified background because you don't know what that inquiry will return, and if it returns anything that contradicts what you think you know, you lose the advantage you're currently trying to use. She tilted her head slightly. You found a wall, which means you already know that whatever's behind it isn't yours to open. The silence in that office was a different quality now. Denser. Harlow looked at her with an expression that had moved for the first time since she'd encountered him out of the territory of controlled superiority and into something more genuinely unreadable. You're not a typical nurse, he said. No, she agreed, I'm not. Then what are you, Right now I'm someone who has a patient in surgery who I need to be available for when he comes out. She stood up. Harlow didn't stop her immediately, which was itself information, the half-second pause of a man recalibrating, deciding whether his authority in this room was sufficient to keep her in the chair, and arriving at an answer he didn't like. This conversation isn't finished, he said. I know, she said. It'll keep. She walked out of his office with her spine straight and her footsteps even, and the full understanding that she had just done something that had a cost she hadn't finished calculating yet. The hallway outside administrative was long and quiet, and she used the length of it to run the situation as it currently stood. Harlow knew about the call sign. He'd run a deeper background check. He'd hit a classification wall, which meant he'd reached the boundary of what his resources could access, but not crossed it. Alex Donovan was in surgery and had told her in the half-articulate urgency of a man barely holding on to consciousness that the mission wasn't over. Two of those three things were concerning in straightforward ways. The third one was something else, the kind of something else that she'd spent 4 years trying to put behind her and had apparently only been storing. She was back on the trauma floor by 11:40. Brenda looked at her when she came through, a full reading look, the kind Brenda did when she was trying to determine what a person had been through without making them say it. "How'd it go?" Brenda said. "Fine. You have got 2 patients flagged for medication review, and Mr. Garza is demanding to see his chart because he's convinced we're giving him something for his prostate that he didn't consent to. He's been watching too much TV," Mia said. "I'll go talk to him." "Mia," Brenda's voice caught her, lower now, quieter. "Harrison came down while you were upstairs. He's been asking about you." She stopped. "Asking what?" "Asking generally, the way people ask when they're trying to gather information without appearing to gather information." Brenda held her gaze. "Whatever's happening, you don't have to handle it alone. You know that, right?" Mia looked at her at the genuine, uncomplicated concern on Brenda's face, the kind of concern that came without agenda, without calculation, without any currency attached to it, and felt something complicated move through her chest that she elected not to examine too closely right now. "I know," she said. "Thank you." She spent the next hour in motion patients charts, the 15-minute conversation with Mr. Garza that required all of her interpersonal patience and resulted in him agreeing grudgingly that yes, the medication was for blood pressure and not anything else, though he maintained the right to remain suspicious. She was good with him. She was good with patients in a way that had always surprised people who expected former special operations personnel to be hard and remote, because the skills that made her good at that had always been at root the same skills that made her good at this. Reading people, understanding what they needed, moving through a high-stress environment without transmitting the stress outward. She was charting at the nurse's station at 12:50 when her phone buzzed, a number she hadn't seen in 4 years. She looked at it for exactly 3 seconds. She stepped into the supply room, closed the door, and answered. "Raven." The voice on the other end was a woman's, low, careful, the clipped precision of someone who chose every word with the efficiency of someone who'd operated in environments where words had weight. "Commander Diana Reyes, Mia's former CO. "How did you get this number?" Mia said. "The same way I get everything. Are you somewhere you can talk? Supply room, briefly." "Donovan made contact with you." It wasn't a question. Nothing Reyes said was ever quite a question. "He's in surgery," Mia said. "Abdominal bleed on top of the chest wounds. He said the mission wasn't finished." "The mission is actively compromised," Reyes said. "There were 3 operators unaccounted for in the extraction failure. 2 have been located. The 3rd is still in field, and the intelligence he was carrying has to be assumed compromised." "What does that have to do with Donovan?" A pause, the specific pause of someone deciding how much to say. "Donovan wasn't just a casualty of the mission failure, Raven. He was the primary extraction asset. He was bringing something out. Something that we certain parties are very motivated to ensure doesn't reach its destination." Another pause. "The hospital is not a safe location for him right now." Mia absorbed this with the practiced calm of someone who had received information like this before, not in hospital supply rooms, but in satellite comms, in field briefings, in the specific context of understanding that the threat you know about is rarely the whole threat. "What are you telling me?" she said. "I'm telling you to watch your perimeter," Reyes said. "And I'm telling you that you may be the only person in that building who has both the access and the capability to keep him alive if something moves." "I'm a nurse," Mia said. "I left." "You know why I left?" "I know," Reyes said. "I'm not asking you to come back. I'm asking you to stay where you are and be what you are. A beat. Both versions of it." The line went quiet. Mia stood in the supply room for 6 seconds, then walked back out onto the floor. At 1:37, Donovan came out of surgery. Harrison briefed the small assembly of relevant staff in the corridor outside recovery. Successful repair of the mesenteric bleed, blood loss significant, but managed prognosis substantially improved, expected to regain full consciousness within a few hours as anesthesia cleared. Mia listened from the edge of the group. She noticed three things that Harrison didn't mention. The first was that the recovery room Donovan had been assigned to was at the end of a corridor that had 2 points of access, easy to monitor, hard to secure, the kind of layout that in a different context she would have flagged immediately as tactically problematic. The second was that there was a man in the waiting area at the end of the hall who had been there since 11 and had not moved or made any calls or done anything that a typical worried family member or colleague did in waiting rooms. He had simply sat and watched with the particular quality of stillness that Mia recognized from the inside. The third was that someone had accessed the hospital's internal admissions database for Donovan's records 3 times in the last hour from a terminal that was registered to administrative services. She knew this because she'd asked Teresa in the most casual tone available to her whether it ever logged access patterns on patient files, and Teresa had pulled it up with the helpful curiosity of someone who didn't understand what the answer implied. She walked to the end of the corridor. She sat down in a chair 2 seats away from the man in the waiting area and opened the chart folder she was carrying and appeared to review it. In her peripheral vision, she clocked him completely. 40 to 45. Civilian clothes that fit slightly wrong across the shoulders in the specific way of someone accustomed to carrying gear. Hands resting on his thighs, not folded, not fidgeting, watching the recovery corridor door with the patience of professional waiting. She stood up after 4 minutes and walked back to the nurse's station. She picked up the desk phone and called security extension with the unhurried manner of someone making a routine inquiry. "This is Walker from trauma," she said when the desk answered. "Can you confirm whether the waiting area on Recovery 3 has been checked today? We've had some concerns about unauthorized access near sensitive patient areas. Might be worth a walkthrough." She hung up. Then she went to find Harrison. He was in the break room with a coffee cup and the expression of a man who had performed 2 complex procedures before noon and was entitled to exactly 7 minutes of sitting down. He looked up when she came in. "Walker, I need to tell you something," she said, "about Donovan." He set the cup down. "All right. There's someone in the recovery waiting area who isn't family, isn't staff, and has been there since before his surgery completed. And someone ran his admission records 3 times in the last hour from an admin terminal." She kept her voice even and factual, the briefing tone. "I think we need to consider moving him to a more secure location and notifying his military point of contact." Harrison looked at her steadily for a long moment. She watched him run through the available responses: skepticism, dismissal, the reflex of a man who had spent a morning recalibrating his route on her, and land somewhere different than he would have landed yesterday. "Why do you think this?" he said, not challenging, genuinely asking. "Because I know what professional surveillance looks like," she said. "And because Captain Donovan told me before he went into surgery that the mission wasn't over." Silence. "The mission," Harrison repeated. "Yes." He looked at her with the full, undisguised weight of a man revising a calculation he'd thought was finished. "Walker, who are you?" She held his gaze. "Right now, I'm the person telling you that your patient may be in danger, and we have a window to do something about it before that window closes." Harrison stood up, set the cup down. "What do you need?" "Security to move him from Recovery 3 to a private room on a different floor, something with a single access point. And I need you to contact whoever the military liaison is for this transfer and tell them he's awake and they need to get someone here. And the man in the waiting area, security will handle the conversation. If he leaves, that tells us something. If he stays and pushes back, that tells us more." Harrison was already moving toward the door. He stopped with his hand on the frame and turned back. "The call sign Donovan used," he said. "Raven." His voice was careful. "That's you." She said nothing. He nodded once, the slow processing nod of a man filing something enormous into a category his existing framework hadn't previously contained, and walked out. Mia stood alone in the break room. Outside, she could hear the floor doing what floors did, the beeps, the footsteps, the ambient, mechanical rhythm of a place that kept running regardless of what was happening to any of the individual humans inside it. She listened to it for exactly the amount of time she could afford, which was not long. Then she heard something that stopped every other thought cold. The security desk extension ringing. Not the ring of an incoming call. The ring of an alarm that had been triggered, the specific pattern, too short one, long that she'd memorized in her first week because she always memorized alarm patterns because it was the kind of thing you did when you couldn't stop yourself from doing it. Recovery 3. She was already running. She covered the distance to the recovery corridor in 19 seconds. The door swung open in front of her, and she went through it without slowing, and what she saw on the other side stopped her for half a second, not from surprise, because surprise was a luxury, but from the sharp, ice-clear recognition that Reyes had been exactly right. The waiting area man was inside the corridor. He was moving fast toward Donovan's room. One of the recovery nurses was backed against the wall with her hands up in an expression of pure paralyzed shock. He hadn't seen Mia yet. She had approximately 4 seconds before he reached the door. She used 2 of them. "Hey," she said. He turned, and Mia Walker, who was a nurse who had a nursing degree and a state license in 2 years and 4 months of clean, quiet, unremarkable employment, moved through the remaining distance between them with the specific efficiency of 7 years of training that no civilian resume had ever contained, and showed him in the most direct way available to her exactly who he was dealing with. The man was trained. She knew it in the first half second, the way he absorbed the surprise of her presence, without fully losing his footing, the way his body adjusted, the way his hands came up, with the practiced economy of someone who had done this before in environments that made a hospital corridor look straightforward. But he'd been sitting in a waiting room chair for 2.5 hours. She had not. She took him down in 8 seconds. Not dramatically, not the way it looked in movies where everything was loud and crashing and cinematic. Quietly, efficiently. 2 precise points of contact weight, redirected leverage applied, and then he was on the floor with his face against the linoleum and his right arm at an angle that made moving inadvisable, and Mia was kneeling beside him with one hand keeping that angle exactly where it was, and her voice coming out completely, almost insultingly calm. "Don't," she said. He stopped moving. The recovery nurse, a woman named Patrice, who Mia recognized from the schedule, mid-50s, 20 years of experience, a person who had seen a great deal, made a sound that was not quite a word and pressed herself further against the wall. "Patrice," Mia said without looking up, "call security. Tell them recovery. 3, tell them to send 2 people and tell them not to rush in loud." A beat. "Patrice." "Yes," Patrice said. The syllable came out thin and breathless, but functional. She moved toward the phone. The man on the floor said nothing. He was doing the calculation Mia expected him to do, assessing his position, her grip, the geometry of the situation, and arriving, she hoped, at the correct conclusion, which was that none of the available options improved his circumstances. "Who sent you?" she said. Silence. "You came here in civilian clothes with no ID visible and no stated relationship to the patient, and you moved on his room the moment security started a walkthrough." She kept her voice level, the voice of someone providing a logical summary rather than an accusation. "That tells me you are not improvising. You had a timeline and something disrupted it, which means someone is watching this situation from outside this building, and they're going to know very quickly that this attempt didn't work." She let that settle for a moment. "So you can talk to me, or you can talk to the people who are about to walk through that door. Your choice." He said nothing, but his body, she noted, had made a very small, very specific shift, not resistance, not preparation for another attempt. The shift of someone who had moved a calculation from active to suspended. Security arrived at 90 seconds. 2 men, both of them looking at the scene on the floor, with expressions that moved rapidly from professional readiness through confusion and into the particular stunned blankness of people whose situational training had not specifically prepared them for this. "He was attempting unauthorized access to a patient room," Mia said, standing, releasing the arm, with a movement that was deliberate enough to communicate that she was choosing to release it. "Detain him and call to your chief. You need to escalate this to hospital administration and contact the military liaison on file for patient Donovan. Don't let him make any calls until your chief clears it." The senior security officer, his badge read Kowalski, and he had the build of a former MP, which Mia had clocked on her first week, looked at her with an expression that wanted to ask approximately 17 questions and correctly identified this as not the moment. "Yes, ma'am," he said. She walked out of the corridor. In the hallway, she found Harrison, who had clearly been running his shoes, were loud on the floor, and he was slightly out of breath in the way of a man who spent his physical energy in operating rooms rather than corridors. "What happened?" he said. "The man in the waiting area made his move," she said. "Security has him. You need to get Donovan moved in the next 20 minutes. Whatever room you put him in, I want to know which one." Harrison stared at her. Did you just 20 minutes, she said. "Can you do that?" He closed his mouth, opened it again. "Yes, I can do that." "Good." She looked at him steadily. "And Harrison, when you contact the military liaison, tell them Raven said the package is intact. They'll understand what that means." She left him standing there and went back to the trauma floor because she had 3 patients who needed medication reviews, and Mr. Garza, who was probably convinced by now that they were definitely giving him something he hadn't consented to, and the floor didn't stop because her life had just complicated itself significantly. She was through the afternoon on pure functional autopilot, the part of her that was a nurse doing what nurses did, the part of her that was something else running a parallel track of threat assessment and contingency mapping. She charted. She administered. She answered Teresa's questions about a post-op complication with the specific clarity of someone who had made a decision to be present in both worlds she inhabited simultaneously rather than choosing between them. At 3:17, her phone buzzed. A text from an unsaved number, 4 words. "Package received. Stand by." It was enough. Reyes had people moving. At 3:44, Brenda appeared at the nurse's station with the expression of someone carrying news they had been turning over in their hands trying to decide how to deliver. "Harlow called an emergency staff meeting," she said. 5 o'clock, all department heads and senior staff. He specifically listed you on the attendance requirement." Mia looked at her. By name, by name." She absorbed that. "All right." "Mia," Brenda's voice dropped. "Kowalski from security came up here 20 minutes ago looking for Harrison. He had that look, the look people get when something happened that's above the level of what they normally deal with. Did something happen in recovery?" Mia kept her eyes on the chart she was updating. "There was a situation, it's been handled." "A situation?" "Yes." Brenda was quiet for a moment, then, I've worked with a lot of nurses in 22 years. A lot of good ones, some exceptional ones." She paused. "I've never worked with one who makes security call their chief and gets specifically named by a CEO in an emergency meeting on the same afternoon." Another pause. "I'm not asking you to explain. I just want you to know that whatever's happening, I'm in your corner." Mia stopped typing. She looked at Brenda, at this woman who had pointed a pen at her about breakfast this morning, who had spent 2 years being quietly, steadily decent without ever making Mia feel like that decency came with a cost, and felt something behind her sternum that was not a clinical sensation. "Thank you," she said, and meant it in a way that didn't have a more precise expression available to it. She stopped by Donovan's new room at 4:15. Harrison had moved him to a private room on the 4th floor single-access corridor and stationed a hospital security officer at the door, a concession that had apparently required significant leverage on Harrison's part, the details of which he'd conveyed to her in a brief, slightly shell-shocked hallway conversation at 4 o'clock. Donovan was conscious. Not fully, he was in the gauzy, heavy half-world of post-surgical anesthesia and pain management, the place where people were present enough to speak and not present enough to filter what they said. But his eyes were open and tracking when she came through the door, and they found her face with an immediacy that had suggested some part of him had been waiting. "You look terrible," she said, pulling a chair to the bedside. His mouth moved, almost a smile. "You look the same." "That's because I haven't been shot 3 times. 4. His voice was rough, barely above a murmur. "The imaging missed 1. Soft tissue upper back. He exhaled slowly. "It's fine. I've had worse." "You haven't had worse." "I have." "Name 1 time." He was quiet for a moment, the pause of a man either thinking or losing the thread to sedation. Then, "Kandahar, 2019. You weren't there for that one." "No," she said. "I wasn't." The weight of that sat between them for a moment, the specific weight of the years that had accumulated in the gap between the last time they'd been in the same room and now. "What did you bring out?" she said, quietly, directly, the way she'd always talked to him without the careful angles she used with most people. His eyes focused on her more completely. "I can't." Reyes called me, she said. I'm inside whatever perimeter she's setting up, whether either of us likes it. So tell me what I'm standing next to. A long pause. His eyes moved to the ceiling, came back. Names, he said. A list. Personnel embedded in 4 different military installations. Domestic, people who've been feeding operational data to outside parties for. He stopped breathing carefully for a long time, long enough that some of the operations that went wrong weren't accidents. She was still. The absolute stillness of a person receiving information that rearranges the weight distribution of everything around it. How long have you had it? 11 days. It's not physical. It's here. He touched his temple with 2 fingers. All of it. Memorized. That was the protocol, nothing extractable. I am the extraction. She looked at him for a moment. That's why they came here. They need me to not reach debrief, he said. Dead or incapacitated long enough for the window to close and the embedded personnel to relocate. His eyes held hers, the man in the waiting area. Handled. Something moved across his face. Of course it is. He exhaled, and for a moment he just looked at her, not assessing, not reporting, not operating. Just looking the way people looked when they'd spent a long time not being able to do something simple. Raven, why did you leave? The question landed quietly. It had no tactical component. It was just a question, the kind people asked in the small windows between everything else, when the everything else paused long enough to let it through. She looked at her hands for a moment. Because I was good at it, she said, and I needed to find out if I was good at anything else. And are you, she looked at him, I'm a good nurse, Alex. I know, he said. I watched you work on me, even half dead. The almost smile again, faint and real. You always were something else. The monitor above his bed produced a sound that made her eyes move to it, automatically his heart rate climbing slightly, the measurement of a conversation his body was paying for an energy it didn't have to spare. You need to stop talking and sleep, she said. I need to get to debrief. You need to survive to get to debrief, which means you need to heal, which means you need to stop spending what you don't have. She stood up. Reyes has people coming. You're not doing this alone. You're here, he said. That's already something. She looked at him for one more second. Then she pulled the blanket up an inch the way you did for patients. The routine gesture of care, and told herself that was all it was. Sleep, she said. She walked out. In the corridor, she almost walked directly into Richard Harlow. He was standing just outside the door with the particular stillness of a man who had been there long enough to have heard a portion of the conversation inside, and the expression on his face was not the expression of administrative authority or tactical leverage. It was something more unguarded than either of those. He looked for the first time since she'd encountered him like a person rather than a function. How long have you been standing there, she said. Long enough, he said. She looked at him and felt the familiar cold calculation run what he'd heard, what he understood, what he was going to do with it, and found something unexpected in the calculation. Harlow's face did not look like a man assembling with leverage. It looked like a man reassessing something fundamental. The man in my waiting area, he said. Security has confirmed he was carrying credentials that didn't clear when they ran them. Counterfeit federal ID. Yes. And you knew, he said. You knew before security ran anything. Yes. He was quiet for a moment. Who are you protecting him from? She considered how much of the answer was safe to give to a man she didn't trust. Decided that in this specific situation, a partial truth was more useful than a wall. People who don't want what he knows to reach the people it needs to reach, she said. People with resources, the kind that can access an admissions database from an administrative terminal and make it look routine. Harlow's jaw tightened. It was a very small movement. That terminal is in my suite of administrative access. I know. The silence that followed was a different quality from any of the silences that had existed between them before. This one had something complicated in it, the specific discomfort of a powerful man confronting the possibility that something had used his infrastructure without his knowledge. You think he started. I don't know what you are yet, she said, but I know that access came from your administrative block, and I know you ran a deep background check on me this morning, and I know you had Donovan's name before his chart was formally processed. She held his gaze. So I'm paying attention. Harlow looked at her with an expression that took her a moment to categorize. Then she had it. It was the expression of a man who was genuinely uncomfortably surprised to be on the receiving end of exactly the kind of scrutiny he routinely applied to others. The background check, he said slowly. I ran because your file was thin and I had a hospital to protect. And the admissions access, I didn't authorize any admissions access from my block. His voice was flat and very specific. If that access came from my system, someone used my credentials. She studied him for 5 seconds. The micro-signals eye movement jaw set the quality of his stillness ran through her internal assessment in the practiced way of someone who had spent years reading people in conditions where being wrong was not a recoverable error. He was telling the truth. Or he was very, very good at lying, and she'd met very good liars, and she'd been wrong before, and she filed the uncertainty where it belonged and kept it there. Then you have a problem in your administrative system, she said, and you need to report it to your IT security and to the military liaison who's going to be calling you in approximately the next 2 hours. The military liaison, he repeated. Yes. She paused. And Harlow, the morning in the changing room, something shifted in his face. A different kind of discomfort, smaller, more personal. I owe you an apology for that, he said. The words came out with the particular difficulty of words that had been assembled by someone who didn't use them often in this configuration. You do, she said simply, but right now it's not the most important thing on either of our lists. She walked past him toward the elevator. At 4:59, she walked into the conference room on the administrative floor for the emergency staff meeting and found 12 people already seated, including Harrison Brenda, Dr. Adiora, 3 department heads she recognized by face rather than name, and Harlow at the head of the table with an expression she now read differently than she would have read it an hour ago. She took the remaining seat, which was directly across from Harrison. Harrison looked at her across the table with the expression of a man who had spent the last several hours substantially revising his entire model of the person he thought he'd been working beside for 2 years. Walker, he said. Harrison, she said. The meeting started. Harlow covered 4 administrative items in 12 minutes in the brisk, directed way of a man who had decided the meeting had a real purpose he was moving toward. He covered facility security protocols, patient data, access, a new procedure for military transfer documentation. The room listened with the attentiveness of people who sensed the meeting had a destination that hadn't been named yet. Then Harlow said, I want to address something that happened today in this hospital that most of you are aware of to varying degrees. The room went very quiet. A security incident in the recovery unit this afternoon involved an unauthorized individual who had falsified federal credentials to gain access to this facility. He paused. The incident was resolved before any patient harm occurred. It was resolved, he said, and his eyes moved across the table to Mia, by a member of our nursing staff who identified and neutralized the threat before hospital security had completed their response. 12 people in that room, 12 sets of eyes that found Mia Walker at approximately the same moment. She sat with her hands on the table and her face neutral. I want the team to understand, Harlow continued, that we have a staff member in this hospital whose background and capabilities significantly exceed what any of us had understood. He paused again, and she could see the effort in him, the specific effort of a man who had spent his entire career in the position of knowing more than the rooms he walked into, working through the particular discomfort of reversing that position publicly. And I want to say for the record that the way I've treated that staff member since my arrival at this facility has not reflected the respect that her expertise deserves. The room was very still. Brenda, Mia noticed, was looking at Harlow with the expression of someone revising a firmly held opinion against their preference. Harrison was looking at the table. Adaora was looking at Mia with wide, direct, completely undisguised awe. Mia looked at Harlow across the table and said nothing, because she didn't have anything to say that the moment hadn't already said better, and because some things were more powerful received in silence than answered. The meeting concluded at 5:40. People filed out in the particular configuration of a group that had a great deal to process and was doing it quietly. Harrison paused at the door, turned back, looked at Mia with the full weight of 2 years of compacted miscalculation. I should have listened to you, he said, in the bay, from the beginning. You listened when it mattered, she said. Today, you listened. That's not nothing. He nodded, slow, genuine, and walked out. Brenda was the last one left in the room besides Mia. She sat down in the chair next to her, folded her hands on the table, and looked at her with the expression of someone who had decided to skip all the intermediate steps and go directly to the thing. So, Brenda said, so Mia said, Navy SEAL, former, combat medic, among other things. The man in recovery, yes. Brenda looked at her for a long, measuring moment. Then she laughed, a short, genuine, completely helpless laugh that released something in the room. 2 years, she said. 2 years I've been telling you to eat breakfast, and you were... She shook her head. You were a Navy SEAL. I was a Navy SEAL who also needs breakfast, Mia said. Those things aren't mutually exclusive. Brenda laughed again, and Mia felt the corner of her mouth pull up against her better judgment, and for a moment the room held something that was lighter than everything that had been in it before. Then Mia's phone buzzed. She looked at it. A message from the unsaved number Reyes. 3 words. Come to debrief. She looked at it for a long moment, looked at Brenda, looked at the window where the late afternoon was doing what late afternoons in autumn did, going golden, and then going dark, the reliable indifference of time moving, regardless of what happened inside any building beneath it. She thought about a man on the 4th floor who had 11 days of memorized intelligence and 4 gunshot wounds, and the particular stubbornness of someone who had never once finished being not finished. She thought about names on a list that had already cost lives and would cost more if they didn't reach the right people. She thought about a mission that she hadn't been part of when it started. She thought about both versions of herself, the one who had walked into this building 2 years ago trying to build a life that looked different, and the one who had taken down a trained operative in a hospital corridor this afternoon in 8 seconds without raising her voice. She typed back, I'll be there. She put the phone in her pocket and stood up. I need to take care of something tonight, she said to Brenda. Brenda looked at her with the expression of a woman who understood now what that sentence might mean. Go, she said. Do what you have to do. Mia picked up her jacket from the back of the chair. She walked to the door. Mia, Brenda said. She turned. Be careful. Mia looked at her, at the genuine, unconditional quality of it, the kind of thing that had no tactical value and no strategic function, and was simply what it was, and felt something settle in her that had been slightly unmoored for longer than she'd acknowledged. Always, she said. She walked out of the conference room, down the corridor, and into the elevator. She pressed 4. She had one more thing to do before she left the building. Donovan was asleep when she came back into his room, and she didn't wake him. She stood beside his bed for 30 seconds, looking at the monitors, reading the numbers with the dual fluency of a nurse and an operator, and finding them acceptable on both measures. His breathing was steady. His color had improved. He was going to make it. She put her hand briefly on the bed rail. Not on him, just on the rail, just a point of contact with the geography of the space he was in, and then she straightened up and looked at him one more time. I'll see you on the other side, she said quietly to a sleeping man. Then Mia Walker Nurse, former Navy SEAL, the woman nobody had seen clearly until today, walked out into the corridor and toward whatever came next. The debrief location was a federal building 12 minutes from the hospital, not a dramatic destination, not a place that announced its purpose from the outside, just a building that looked like every other building on that block and had 3 more layers of security than any of them once you got past the lobby. Mia had been inside it before years ago under different circumstances, walking through it with the specific confidence of someone who belonged there in ways that didn't require explanation. She walked through it now the same way. Commander Diana Reyes was waiting in a conference room on the 4th floor with 2 people Mia didn't recognize, and one she did, a senior intelligence officer named Garrett, who had the kind of face that communicated absolutely nothing about what he was thinking, which was itself a form of communication she'd learned to read. Reyes looked at her when she came through the door with the expression of a woman who had been holding a great deal of moving pieces together for a long time and was registering the arrival of one more piece falling into place. Raven, she said. I go by Walker now, Mia said. You go by whatever you need to go by, Reyes said. Sit down. She sat. The debrief took 47 minutes. Mia gave them everything: the timeline from Donovan's arrival, the second deterioration, the man in the waiting area, the administrative database access, Harlow's credentials being used without his authorization. She gave it in the flat, sequential, emotionally stripped manner of a field report, which was what it was, and the two people she didn't recognize typed rapidly and asked clarifying questions with the efficiency of people who were very good at their jobs. Garrett looked at her throughout with the unreadable face and said nothing until she finished. Then he said, "The individual from the recovery corridor, what can you tell us about his training profile?" "Eastern European school," she said. "FSB adjacent." "I'd estimate, though, that's not a certainty. His reaction timing was good, but he'd been stationary too long. He'd underestimated the environment." "He underestimated you," Garrett said. "Same thing," she said. Reyes leaned forward. "The administrative access. Harlow's credentials being used, we've traced the origin. It came from inside the hospital, not the administrative suite. The credentials were cloned remotely, but the access point was an internal terminal. Someone inside the building facilitated it." Mia was still. "Who?" "We're still working that piece," Reyes said, "but it narrows the field significantly." She paused. "We need you to go back." Mia looked at her. "To the hospital. Tonight." The access point terminal is in the radiology department on the second floor. It was used twice, once to pull Donovan's admission record once at 3:40 this afternoon, which was after the recovery incident. Reyes held her gaze steadily. Someone inside that building made a second contact attempt after the first one failed. That contact hasn't been identified yet, and until it is, Donovan is still exposed. "You have people watching the room," Mia said. "I have two people in the building, and neither of them has your access or your read on the internal personnel." Reyes paused, and the pause had the particular weight of a woman who was asking for something she had no formal authority to ask for. "I'm not ordering you, Walker. You left. That was your right, and I've never said otherwise." "But I'll go back," Mia said. Reyes stopped. "I was already going to," Mia said. "I have patients on the morning shift." Something moved across Reyes's face that lasted less than a second and was more honest than anything Mia had seen from her in 7 years of working together. It was relief, and it was gratitude, and it was something that sat underneath both of those that neither of them was going to name out loud in a federal building with Garrett in the room. "The terminal," Mia said. "Do you have the exact access times?" 3:41 and 3:44, 3 minutes apart. She ran that against her memory of the afternoon. "I was in the staff meeting at that point. Most senior personnel were accounted for." She thought. "Radiology second floor 341, who was rostered?" Reyes slid a tablet across the table. She looked at the radiology roster. 3 names. She knew 2 of them by face, had interacted with both within the last week. The third, a radiology technician named Carl Brewer, she'd seen twice in the hallways and filed away in the background category of personnel who were present but unremarkable. Carl Brewer, she now noticed, had been employed at Redstone for 6 months. He had transferred from a facility in the Pacific Northwest. His employment record was clean. His references had been checked. His background had cleared the same HR system that Harlow had called inadequate when reviewing her own file. She looked at Garrett. "The background check Harlow ran on me this morning. Did he run any others?" Garrett's unreadable face produced the smallest, most economical version of surprised. "We don't have that information." "Get it," she said. "Because if Harlow's instinct was to run deeper checks on personnel with thin files, he may have flagged more than just me. And if Brewer's file was constructed the same way mine was deliberately thin, Harlow may have a record of that inquiry sitting in his system that we can use." Reyes looked at Garrett. Garrett picked up his phone. Mia stood up. "I'm going back to the hospital." She drove back in the dark with the particular quality of alertness that had settled over her like a second skin the moment she'd walked out of that hospital elevator and stopped pretending it wasn't there. The city moved past the car windows with its indifferent nighttime rhythm, and she drove through it thinking about a radiology technician named Carl Brewer and the 3 minutes between 2 database accesses and the specific shape of a threat that hadn't finished yet. She badged in through the staff entrance at 8:53. The night floor was operating at its reduced, quieter register, fewer bodies, lower light, the particular atmosphere of a building doing its maintenance work rather than its public-facing work. She knew the layout by cardiac memory at this point. She knew which corridors were empty at which times. She moved through the hospital the way she moved through environments she'd mapped without appearing to navigate. She went to the 4th floor first. The security officer outside Donovan's room was one of Reyes's people. She recognized him from the federal building, though he was in hospital security uniform now, and he gave her the minimal nod of someone confirming she was expected. She went inside. Donovan was awake, more awake than he should have been, which was consistent with everything she knew about him, his body's stubborn refusal to follow the schedule that physiology prescribed for it. He was sitting up at an angle that was probably against medical advice and looked up when she came through the door with the alert, immediate focus of someone who had been lying there running threat assessments and was relieved to have an external data point. "You went to debrief," he said. "Yes. Reyes asked you to come back." "I was coming back anyway." She pulled the chair to the bedside. "There's someone inside the building. Radiology tech named Brewer. We think he made a second contact attempt after the recovery incident." Donovan's jaw tightened. "He's escalating the timeline, which means someone outside is applying pressure." She looked at him. "The intelligence you're carrying, is there a time component, a window where it stops being actionable?" 72 hours from extraction, he said. "After that, the embedded personnel will have protocols to trigger relocation." The list becomes not useless, but significantly less complete. His eyes found hers with the direct, stripped focus he'd always used when the situation required no intermediary language. "We're at hour 31, Raven." Oh, she absorbed that. 41 hours left. "And someone in this building knows that math as well as I do." She stood up. "I need to find Brewer." "Walker." His voice caught her at the door, the specific quality of it, not operational. Now just his voice. The one she'd known before call signs and mission profiles and the 7 years she'd spent becoming someone who could do what needed doing and still sleep afterward. "When this is over, Alex. When this is over," he said again, not letting her redirect it. "I'd like to have a conversation that isn't conducted under any kind of operational pressure." She looked at him for a moment from the doorway. "When this is over," she said, "we'll see." It wasn't a no. They both understood it wasn't a no. She walked out. The radiology department on the second floor was officially closed for the night, equipment running on scheduled maintenance protocols, the main desk unmanned until the 6 o'clock shift. It was the kind of department that had a reason to run quiet and a reason to have personnel present at non-standard hours, which made it exactly the kind of location that certain kinds of people selected for certain kinds of activities. She came down the back stairwell, not the elevator old habit, the preference for routes that didn't announce arrivals. She pushed through the stairwell door and into the corridor and was 3 steps from the radiology department entrance when she saw the light under the door. She stopped. The department was supposed to be dark. She stood in the corridor and ran the 45 seconds of calculation that determined what she was going to do next. She had no weapon. She had her training, her rid of the space from 2 weeks of walking past it, and the understanding that whoever was in that room had already demonstrated they were willing to operate inside a hospital full of patients. She pulled out her phone, sent a text to Reyes second-floor radiology. Then she pushed the door open. Carl Brewer was at the terminal on the far side of the department. He was not alone. There was a second person, a woman Mia hadn't seen before, standing 2 feet away with a phone to her ear, speaking in quiet, rapid Russian that she was making no particular effort to conceal. Brewer saw Mia the same moment she saw him. For 2 seconds, nothing moved. Then the woman with the phone said something short and sharp in Russian that Mia's field language training translated without effort as an instruction to handle it, and Brewer came off the desk toward her with the particular momentum of someone who had been told this was the situation he was being paid for. He was bigger than the man from the recovery corridor. He was not better. She moved to meet him rather than back from him, the counterintuitive response, the one that worked because it disrupted the geometry of what he'd expected, and what followed was brief and not clean, and left her with a cut on her forearm from a piece of equipment that caught her wrong, and Brewer on the floor breathing hard with a wrist that was going to need imaging. The woman with the phone had not run. She was standing with the phone still raised, and she looked at Mia across the room with the cold, assessing expression of a professional who was recalibrating rapidly, and Mia looked back at her, and they both understood what the next 10 seconds were going to determine. "The debrief already happened," Mia said, in Russian, the specific phrasing of someone who had learned the language in environments where getting it wrong was not recoverable. "Whatever he was carrying is already in the right hands. Whatever you're trying to protect has already been compromised." Making another move in this building doesn't change that math. The woman looked at her for a long moment. Then she lowered the phone. "Who are you?" she said. In English, accented precise. "I'm a nurse," Mia said. The woman looked at Brewer on the floor, looked at Mia. Something in her face moved through several calculations and arrived at an answer. "Nurses," she said with an inflection that was not quite admiration and not quite anything else, "do not speak Russian." "This one does," Maya said. Reyes's people came through the door 40 seconds later. The next 3 hours were federal jurisdiction, controlled, documented, conducted with the efficient machinery of agencies that had been building toward this outcome since long before any of it had entered the walls of Redstone Military Medical Center. Mia gave her account, gave it completely, and then stepped back and let it belong to the people whose job it was. She was back in the hospital at 12:30 in the morning. Not to her floor, the night shift had her covered, but to the 4th floor, to the single-access corridor, to the room where the security officer gave her the same minimal nod. She didn't go inside this time. She stood in the corridor and looked through the window at the monitors, at the steady lines, at the numbers that told her what she needed to know, and she let herself have the particular exhale of someone who has carried a weight to its destination and set it down. At 7:15 the next morning, she was at the nurse's station in her crisp uniform, with her hair in its tight bun, reviewing overnight charts with the focused efficiency of someone beginning a regular shift when Brenda appeared at her elbow with 2 cups of coffee and set one in front of her without comment. She picked it up, drank it. "How bad was last night?" Brenda said. Not asking for details, just asking the shape of it. "It's over," Mia said. Brenda nodded. That was enough. Teresa Lynn came onto the floor at 7:20 and stopped 2 feet from the nurse's station, looking at Mia with the expression of someone who had spent the evening processing a day's worth of information that had fundamentally reorganized several assumptions. "So," Teresa said, "good morning, Teresa. You took down 2 people yesterday. Let's check the medication round. You speak Russian. Teresa, you are a former Navy SEAL who works as a nurse at a regular hospital. At a very good hospital," Mia said, "with good people. Pull the medication cart." Teresa pulled the medication cart, still visibly processing, and Mia felt the corner of her mouth do the thing it had done with Brent the night before, the involuntary helpless pull that was not quite a smile but was in the neighborhood of one. Dr. Adeora found her at 9 o'clock between patient rooms and stood in the corridor looking at her with an expression that was entirely different from the wide-eyed observation of the trauma bay 2 days ago. This was something more deliberate, more considered, the expression of a young doctor who had spent some time thinking about what she'd witnessed and had arrived somewhere significant. "I want to learn," Adeora said. Mia looked at her. "Learn what you know, the way you assessed him into the bay, the way you read the clinical picture faster than anything in the textbook covered. I want to understand how you do that." Mia considered her for a moment. Adeora held the eye contact without flinching, which itself was a data point. "You're already good," Mia said. "The way you responded in ICU when Donovan deteriorated, you moved correctly. You didn't freeze." I froze for a second. A second is acceptable. It means you were processing, not panicking. She paused. "Come find me Thursday afternoon. I'll walk you through the assessment sequence I use." Adora's face did something that started as professional gratitude and arrived at something more personal. "Thank you." "Don't thank me yet," Mia said. "It involves a lot of anatomy you haven't thought about in a tactical context." Harrison came to her at 10:30. He came to her specifically, not in passing. Not incidentally, he walked to where she was charting and stood beside the desk with the deliberate manner of a man who had prepared what he was going to say and was delivering it as a whole rather than improvising. "The military liaison called this morning," he said. "They told me enough of what happened last night that I understand the scope of it." He paused. "I've been thinking about what I said in the bay the first day. You told me the landmark was wrong, and I hesitated because of who I thought you were, because of the category I'd put you in without any actual evidence." He met her eyes. "That's not medicine, that's ego. I almost cost a man his life because of ego, and you kept that from happening." He paused. "I don't know how to adequately account for that." She looked at him steadily. "You can account for it," she said, "by not doing it again. Not to me, not to anyone on this floor. That's all. He held her gaze for a moment, nodded once, agreed. He walked away. She sat with that for 10 seconds, and then she went back to her charts. Richard Harlow appeared at 11:15. He came to the trauma floor, came down to it, rather than summoning, which was in itself a small revolution in the physics of how he moved through the building. He stopped at the nurse's station, and Brenda watched him with the expression of someone watching a weather pattern that had shifted unexpectedly and was revising their forecast. "Walker," he said. She looked up from the chart. A moment. She followed him to the corridor. He stood with his hands in his pockets, not the crossed arms posture of his authority configuration, a different posture, one that she assessed as something close to human, and looked at her with an expression she now had enough data points to read accurately. "Federal agents came to my office this morning," he said. "They walked me through what the clone credentials were used for. They told me what happened last night." He paused. "They also told me that the security breach was facilitated by a personnel gap in our hiring process. A gap," he said, with the precision of a man who had been turning this over, "that the deeper background check protocol I've been trying to implement would have caught." "Yes," she said, "it probably would have. I owe you an apology that is larger than the one I started last night." He said it without qualification, without the lawyerly hedging she would have expected from him 48 hours ago. "The changing room, the personnel review, the way I spoke about you and to you from the moment I arrived. I treated you the way I treat resources, not people." He looked at her directly. "You are not a resource walker. You are—" He stopped, seemed to be searching for a word that was accurate rather than diplomatic. "Exceptional," he said finally, "in ways I didn't have the framework to recognize. And I'm sorry." She looked at him for a long moment. "The deeper background check protocol," she said, "implement it." He blinked. "That's what I'd like from you," she said. "Not on me retroactively, I know what my file says, and I know why. But on new hires going forward. Brewer slipped through because the system was inadequate. Fix the system." Harlow held her gaze. Something settled in his face, the specific settling of a man who had been expecting a larger reckoning and been handed something more useful instead. "Done," he said. "And the specialized trauma unit you mentioned," she said, "the position you offered." "It's still open," he said. "More open than it was yesterday." "I'll think about it," she said, "but I want to keep my current patient load. Whatever the new role involves, it doesn't take me off the floor. I'm not an administrator." "Understood," he said. "I'll put together a structure that reflects that." She nodded. "Then we have a working arrangement." She went back to the nurse's station. Brenda raised an eyebrow. "Working arrangement," Mia said. Brenda's eyebrow went up a further fraction. "That's all I get. For now." She was 2 hours from the end of her shift when she got the call from the 4th floor. Not a crisis call, the calm brief notification of a nurse confirming that the patient in room 412 was requesting to see someone from the trauma team. Specifically requesting, the nurse said, with the particular careful neutrality of someone relaying a message they found slightly unusual in Nurse Walker. She finished what she was doing. She told herself she was going to finish what she was doing before going upstairs, and she did finish it, and it only took her slightly longer than it should have because she was being careful, and not because she was stalling. She went upstairs. Donovan was sitting up in the bed at an angle that was still probably against medical advice, and he looked better than he'd looked yesterday. Color-improved eyes, clear, the particular quality of someone whose body was fighting back with genuine momentum. He looked at her when she came through the door, the same way he'd looked at her in the ICU, with that immediate unguarded recognition that had no operational component to it. "You could have been killed last night," he said. No preamble. "I wasn't," she said. "Walker." "Donovan." She sat in the chair. "I've been in worse situations." "I know, I was there for some of them." He looked at her steadily. "Are you all right?" The question landed with a specific weight, not medically, not professionally. Just the question, the plain human version of it, asked by a person who meant it without any surrounding architecture. She thought about answering it the way she usually answered it. The fine, the good, the efficient deflection. She thought about the supply room and the changing room, and 47 minutes in a federal building and a radiology department at midnight, and 2 years of quiet, careful, deliberate living that had been rebuilt from the inside out in approximately 36 hours. "I'm all right," she said, and may have been. Actually all right. His shoulders dropped a fraction, the release of something he'd been holding. Good, he said. That's good. They sat for a moment in the particular silence of two people who have been through enough together that silence between them had never been empty. The debrief, he said. I go in tomorrow. They'll have the list processed by end of week. Good, she said. Then it's done. Then it's done, he agreed. He looked at her. And then I'd like to take you to dinner, somewhere that isn't a hospital and doesn't involve anyone being in immediate medical jeopardy. She looked at him. You're going to be in recovery for at least 3 weeks. Dinner doesn't require full mobility. You'll be on a restricted diet. We can work around that. Your surgeon is going to tell you not to see Walker. He was watching her with the patient, clear-eyed certainty of a man who had spent 11 days memorizing classified intelligence while bleeding in a field extraction and was not going to be deterred by logistical objections. Yes or no? She looked at him for a long moment. Outside this room, the fourth floor was doing what the fourth floor did. The monitors, the footsteps, the ambient machinery of a place that moved through crisis and recovery, and everything between with the same and different continuity. Somewhere on the floor below, Brenda was pointing a pen at someone about breakfast. Teresa was pulling a medication cart and probably still processing. Adaora was learning. Harrison was being better than he'd been yesterday. Harlow was implementing a protocol that was going to protect someone who hadn't even been hired yet. The hospital was a living thing, and she was part of it, and it had changed around the shape of her being fully in it. Both versions, all of it. Nothing hidden, and that change was permanent now. And it was good. She looked at Alex Donovan, who had known her call sign when nobody else in this building had known her name, and who had spent his last thread of consciousness making sure she understood the mission wasn't over, and who was now looking at her with the specific patience of someone who was very good at waiting for things that mattered. Yes, she said. He smiled. A real one, the kind that reached everything, the kind that 4 gunshot wounds and 11 days in the field hadn't managed to take out of him. Good, he said. She stood up, straightened her scrubs. 3 weeks minimum before you're cleared for anything that isn't bed rest. I'll know if you're pushing it. I have access to your chart. I know you do, he said. That's terrifying. It should be down, she said. She walked to the door, stopped with her hand on the frame, not because she'd planned to stop, but because there was something that needed to be said, and this was the moment it was available. Donovan, she said without turning. Yeah, I'm glad you made it. A pause, the quiet, full pause of someone receiving something they'd needed to hear. Me too, he said. Thanks to you. She walked out into the corridor, past the security officer, down the hallway toward the elevator, toward her floor, toward 3 remaining patients, and an hour of charting and the end of a shift that had begun 2 days ago and would not actually end until some things that had been unfinished for 4 years were finally completely allowed to be finished. Mia Walker had come to Redstone Military Medical Center 2 years and 4 months ago to build a quiet life, and she had built one precise, competent, carefully bounded. What she had not anticipated and what no amount of training or experience or deliberate planning could have prepared her for was that the quiet life and the other life were not actually 2 different things. They were the same person fully inhabited, and the moment she stopped treating them as separate was the moment she became not more dangerous, not more capable, but more whole. She pressed the elevator button, stood with her hands at her sides, looked at her own reflection in the polished elevator doors, and saw what was there clearly, without editing, without management. A nurse, a SEAL, a woman who had taken down 2 trained operatives in a hospital corridor and then gone back to work the next morning and explained to a 72-year-old man why his medication was not in fact a conspiracy. The elevator opened. She stepped in and the doors closed behind her, and Mia Walker, all of her, both of her, the whole and complete and unapologetic truth of her wrote it down to the floor where her patients were waiting. That was who she was. That was who she had always been. And she was done pretending otherwise.